Hi, I'm Lisa Almaguer, and today is Thursday, March 25th, and I am coming to you with the weekly vaccine video update. Today, I'll provide an update on our most current vaccination numbers, booking a vaccine for people who are 50 years old and older, living or working in Butte County, and then I'll answer some popular questions that we've been receiving. So, as always, let's start with our most recent numbers. I'll share my screen. It's a little easier to see these numbers. So total vaccine allocated to Butte County Public Health is 110,545. First doses ordered is 62,935. Second doses ordered is 47,410. And doses received is 100,395. Of those, doses administered or shots in arms is 78,754, and people who have completed their full cycle of vaccination is 30,369. So I will come back to you and let's talk about the exciting news from last week. We announced that Butte County was opening vaccine eligibility to people ages 50 and older living or working in Butte County. This is wonderful news. It's great progress in getting those in our county vaccinated who wish to be so. And there's some confusion around booking this first dose. And there are some limitations in MyTurn, which is the state's scheduling site. So I hope to clear this up for you. So if you're booking your vaccination for the Chico Community Vaccination Clinic, which uses MyTurn, and you're under the age of 65, due to the limitations on MyTurn at this time, you'll need to select the 65 to 74 age group. Once you get to the date of birth section and all the information that's pertinent to you, you will need to enter your actual date of birth. And once the state activates this 50 to 64 age group on their site, this workaround will no longer be needed. And so we anticipate they'll do this soon, but for now, just go ahead and select that older age group. Moving on, we're seeing a lot of questions about the Janssen or the J&J vaccine, and especially people saying that they want to wait to get vaccinated until they can get the J&J. So first and foremost, Butte County Public Health wants to encourage everyone to get vaccinated as soon as they're eligible and to get the vaccine that is offered to you first. The vaccines are safe, they're effective, and they're free, regardless of whether you have insurance or are uninsured or underinsured. And they do work to help to prevent severe illness, hospitalization, and death. So in regards to Butte County receiving the J&J, we have received allocations from the state, but these are early allocations and they're small. They're not enough to include or use for the larger community-based clinics, which vaccinate up to 1,000 people a day. So for these early small allocations, they'll be used for on-site or smaller mobile clinics until we receive larger allocations. Now I'd like to discuss questions about what happens when we have unfilled spots at the community vaccine clinics. There's some misconception that unfilled spots will result in a waste of vaccine, or if that people show up at the end of the day, they can get vaccinated. So both of these statements are not accurate, and I'll explain why. So based on the number of people who are officially booked to get vaccinated on a given day, we only open up enough vaccine to serve those appointments. If we have people who don't show up for an appointment for one reason or another, which is not very many, we offer the vaccine to clinic volunteers and the like. It's important to remember that these community vaccination clinics are by appointment only, and these appointments can be booked on the Butte County Public Health COVID vaccination website. So lastly, let's talk about booking your first and your second dose appointment. Lots of questions about how do I get my second dose? Where do I book my second dose? And it really all depends on where you received your first dose vaccination. So I'm going to share my screen with you again because it's a little easier to talk about the different clinics when we can look at them. So here is the Butte County vaccine website. And I'll scroll down to the community vaccination clinics and So if you book your vaccine at the Chico Community Vaccination Clinic using MyTurn, you will now be prompted to book your first and second dose at time of booking. This is great news. It really streamlines the process. Here's the booking link and here's the available dates, and then it will show you which dates you can choose for your second dose. So scrolling down to the Oroville Community Clinics, if you book your vaccine through Oroville, you will book your first dose through Sign Up Genius. They have not switched over to MyTurn yet, but they will do so in the near future. And so you'll book your first dose, and then once you get to the clinic, they will book your second dose before you leave. So that's great news. And then now you'll see this Chico Hospital Vaccination Clinic. They are using MyTurn. And these appointments are booked through MyTurn. They only book the first dose at this time. You'll receive instructions for booking your second dose when you're at the clinic. So I'll scroll back up and look at this federal retail pharmacy program. I'm seeing lots of comments about people getting vaccinated at pharmacies, which is fantastic. If you book through a retail pharmacy, you will likely have your first and second dose booked at time of booking. Keep in mind, the pharmacy program is separate from the allocations that Butte County receives. And so we often don't know which vaccine they have, how much of the vaccine they have, and we also do not run their scheduling. So they get their allocations from the federal government, whereas Butte County gets our allocations from the state. But again, it's a wonderful option, and they will book first and second doses. So I will stop sharing. And one last thing to talk about, there's been a lot of talk out there about the state in the very near future opening the vaccine to all ages that qualify. And if the state does open to all ages, Butte County supports that decision, and we would follow the state's lead as we have through the entire pandemic. As always, this is always based on receiving enough supply and continuing to get those allocations so we can meet the demand and continue to vaccinate everyone who is eligible. But we look forward to something like that happening and a decision from the state coming, and we will follow suit if the state makes that decision. So as always, thanks for sticking with me. I know it's a lot of information, but hopefully you find it useful and it can answer some of your questions. And until next week, stay safe and healthy.